created by John Bonsack in the 1880s. It's a cigarette rolling machine. And it produced cigarettes very cheaply and very quickly. And it was a very disruptive technology for the tobacco industry. Prior to the 1900s, tobacco was used mostly in the form of cigars and in the form of chewing tobacco. And the primary health concerns were infectious disease because people were spitting everywhere. People weren't that concerned about the chronic diseases associated with it. Cigarettes existed, but a really skilled human worker could only produce about 4 per minute, so they were expensive and a luxury item. This device allowed the initial devices to roll 200 cigarettes per minute. And that's 200 cigarettes per minute created an enormous supply of cheaply produced cigarettes. The problem was there was not sufficient demand to meet this enormous supply. But luckily these guys were here to help. Humphrey Bogart, some Hollywood stars, Madison Avenue advertising. And when you have a highly addictive substance that's fairly cheap and you have a lot of people glamorizing it, it can take off very quickly. And when we look at the cigarette, basically from 1900 to 1964, we saw steady growth in the consumption of cigarettes. It slowed down a little bit during the Depression, but for the most part, we saw a nice steady growth in cigarette smoking up until 1964. Going back to the rolling machine, it's been upgraded a little bit. This is a more fancy one. They can do it even more cheaply and more quickly. These things now account for 443,000 deaths in the United States each year. It's the leading cause of death. And in the public health field, when we talk about large numbers of deaths, we like to talk about product 747s and then we like to crash them. And so I've got a slide showing 747s, crashing, and burning. Are they burning? Oh, it's not. Oh, yeah, they're So, and I stole that too, so full disclosure, I did not make that graphic. But that's a bad analogy, really, because people who die in plane crashes, although it's tragic, it's fairly quick, and it's fairly low medical care cost. A better analogy might be sliding these things off of a runway, and people die very slow, painful, expensive deaths with lots of disability and astronomical healthcare expenses. We spend $133 billion at least each year in the United States dealing with tobacco-related diseases, and so for that reason, lots of people, my colleagues, are interested in dealing with tobacco control and preventing tobacco initiation and helping people quit smoking. A Harvard historian has, you can't read it, but it's the title of my talk, by the way, I finally got to it. It's a cigarette, a 20th century phenomenon, but not for all of us. So a Harvard historian labeled the 1900s as a cigarette century. Prior to the 1900s, cigarettes weren't on anybody's radar. From the first 2/3 of the century, we see really steady progress, or actually progress is a bad way to say it. We saw steady growth in the cigarette industry and cigarette consumption. By 1964, about almost half of adults smoked, about 46% of adults were current smokers. And this upward trend continued up until 1964. In 1964, the Surgeon General officially endorsed this enormous body of observational correlational research demonstrating a link between cigarette smoking and disease. People had been suspicious for a couple of decades, but this was the first time that, because we were using observational data, not experimental data, that the U.S. government had endorsed this body of research and stated, yes, there is a causal link, even though we don't have experimental data. And to quote our vice president, this was a big effing deal. It was released, the report was released on a Saturday to minimize the impact on the stock markets, but to maximize exposure in the Sunday papers. It led a lot of people to quit on their own just because of this new knowledge that was officially endorsed. In fact, one of the anecdotes I love is that the Surgeon General, on his way to give this release, quit smoking in a limo. He didn't think anybody would ask him about that when he was told, the press is going to ask you about your own smoking. He said, well, that's fine, I just quit. So some people quit on their own just because of this report providing new information. But it also provided it prioritized healthcare funding and research at the state and federal level. We now have 50 years of research and also a lot of natural experiments that we know what works in tobacco control. We know what policy strategies, what educational strategies, what taxation strategies work. Most of them are very politically feasible. I mean, that is, the general public supports them, both Republican and Democrat. We know what works. We have a lot of research on how to efficiently reduce tobacco use. In fact, I would say that Since 1964, we've cut the smoking rate in half. Less than 18% of adults smoke. Consumption is down, youth smoking is down. I would say outside of our response to HIV in the 1980s, 90s, and 2000s, that this is one of the most important public health successes since our colleagues in the 1800s figured out you shouldn't mix fecal matter with the drinking water. And that was dealing with lots of infectious diseases that were prominent in the 1800s, such as cholera. But the success has not reached all Americans. If you look at economically disadvantaged people, and you can define that a whole bunch of different ways, but when you look at the demographics, it's gone down for white Americans, it's gone down for African Americans, it's gone down for Asians, women, men, all groups except for the economically disadvantaged. That group is basically continues to have significantly high, substantially and significantly higher rates of tobacco use. And it's this lack of health equity that I wanted to talk about today. There's several potential reasons why people who are more economically disadvantaged are more likely to smoke. Some that come to mind are the fact that they've been targeted by adjudicated racketeers, also known as the tobacco industry. Trivia fact, they have been convicted of racketeering. The only corporations that I know that have been convicted of racketeering, and it was a Mississippi State alum who led the charge on that. It was Shannon Eubanks, who went to undergrad here. And I got distracted, sorry. And then also there's been, if you look at low-income areas, there's more dense or higher density of retail outlets. There's more point-of-sale marketing. There have been also the social climate. People with lower incomes are more likely to have friends who smoke, more likely to be in jobs where smoking is still allowed, and they're more likely to have family members who smoke. So there's lots of potential reasons. And my research covers all kinds of aspects of tobacco control. For the purposes of this group, I thought that the most interesting part to do was talk about this lack of health equity, especially based on income and education.